nose and paranasal sinuses, maxillary nerve, is a purely sensory division of the trigeminal nerve, cranial nerve V. It leaves the cranial fossa to enter the Pterygopalatin Fossa. Its continuation enters the floor of the orbit and exits the orbit via the infraorbital foramen onto the face and side of the nose. Along its route, its branches provide sensory fibers to the face, paranasal sinuses, tonsil, palate, maxillary teeth, and supporting tissues, nasopharynx, and auditory tube. Additionally, the maxillary nerve delivers secretomotor fibers derived from the facial nerve, cranial nerve 7, from the pterygopalatin ganglion to the lacrimal gland and mucosal glands of the nasal fossa, palate, and pharynx. Paranasal sinuses are hollow cavities within the maxillae, frontal, ethmoid, and sphenoid bones. These sinuses, lined with respiratory mucosa, are in communication with the nasal fossa via small ostia. The function of the paranasal sinuses is not clear. The mucus produced within the sinuses drains, via the ostia, into the nasal cavity. However, during nasal congestion, the ostia may be closed so that the sinus, ES, may be filled and unable to drain, thus increasing pressure that may be related to sinusitis, sinus headache, and sinus infection. The maxillary sinus is the largest sinus and, because of the location of its ostium, high on the medial wall, it is difficult to drain and is frequently a source of sinusitis and congestion. Also, the roots of the molar teeth bulge into the floor of the sinus and may create problems for dental treatment. Pterygopalatin fossa is that pyramid-shaped space surrounded by the sphenoid, maxilla, and palatine bones. Housed within this space are the terminals of the maxillary artery, the maxillary division, V2T of the trigeminal nerve, and the pterygopalatin ganglion, a parasympathetic ganglion of the facial nerve. Branches of these structures and their communications serve the region about the nasal cavity, paranasal sinuses, the maxilla, palate, dentition, and supporting structures of the maxillary arch, and parts of the face and cheek. Pterygopalatin ganglion is housed in the Pterygopalatin fossa. It is a parasympathetic ganglion of the autonomic nervous system. Preganglionic parasympathetic nerve fibers originating in the facial nerve, cranial nerve 7, synapse in the ganglion with postganglionic cell bodies whose secretomotor fibers join the maxillary division, valve of the trigeminal nerve and its branches to distribute to the lacrimal gland, and mucosal glands of the nasal fossa, palate, and pharynx. The Pterygopalatin fossa is a small, open space where the maxilla, sphenoid, and palatine bones approximate each other. It is a place where nerves, ganglia, and vessels converge to communicate with other region of the skull. The Pterygopalatin fossa is small, pyramid-shaped space is situated between the maxilla, sphenoid, and palatine bones. It communicates via canals, fissures, and foramina with various regions of the skull. The contents of the Pterygopalatin fossa include the terxillary division of the trigeminal nerve, and branches of these structures. Maxillary artery, the third portion of the maxillary artery leaves the deep face and enters the Pterygopalatin fossa via the pterygomaxillary fissure. Branches of the Pterygopalatin artery serve structures in the orbit as well as the maxilla and teeth, palate, pharynx, paranasal sinuses, nasal cavity, and auditory tube. The third, or Pterygopalatin portion, of the maxillary artery enters the Pterygopalatin fossa from the infratemporal fossa via the pterygomaxillary fissure. Branches of the Pterygopalatin portion of the maxillary artery are the pos pterosuperior alveolar, infraorbital, greater palatine, pharyngeal, and sphenopalatine arteries as well as the artery of the pterygoid canal. The posterior superior alveolar artery branches from the maxillary artery as that vessel enters the pterygomaxillary fissure. It travels on the maxillary tuberosity and enters the posterior superior alveolar foramen accompanied by the like-named nerve. The vessel ramifies within the maxilla to vascularize the maxillary sinus, molars, and premolars as well as the neighboring gingiva. The infraorbital artery, a continuation of the maxillary artery, enters the orbit through the inferior orbital fissure, lies one and the infraorbital groove, leaves the orbit via the infraorbital canal, and enters the face by way of the infraorbital foramen. Branches of the orbital artery are the orbital branches, serving the lacrimal gland and the inferior oblique and inferior rectus muscles, the anterior superior alveolar branches, which vascularize the anterior teeth and the maxillary sinus, and the facial branches. The greater palatine artery and its branch, the lesser palatine artery, pass through the Pterygopalatin canal and gain entrance to the palate via the greater palatine and lesser palatine foramina, respectively, to vascularize the hard and soft palates as well as associated structures. The pharyngeal branch passes dorsally, through the pharyngeal canal, to vascularize the auditory tube, sphenoidal sinus, and portions of the pharynx. The sphenopalatine artery leaves the Pterygopalatin fossa via the sphenopalatine foramen on its medial wall to enter the nasal fossa. The distribution of this vessel and its branches once discussed later in this chapter. The small artery of the pterygoid canal passes through the posterior wall of the Pterygopalatin fossa via the pterygoid canal. It supplies part of the auditory tube, pharynx, middle ear, and sphenoidal sinus. Maxillary nerve. The maxillary nerve, VT, a purely sensory nerve, enters the Pterygopalatin fossa where it gives rise to nerves that serve the orbit, the hard and soft palate, maxillary molars and supporting tissues, portions of the nasal cavity, anterior maxillary teeth and supporting tissues, and nasopharynx. It also communicates with the Pterygopalatin ganglion, a parasympathetic ganglion associated with the facial nerve cranial nerve 7 while in the Pterygopalatin fossa. The maxillary division of the trigeminal nerve enters the Pterygopalatin fossa at its posterior boundary via the foramen rotundum. While in the fossa, it gives off the zygomatic nerve, which, passing into the orbit through the inferior orbital fissure, will bifurcate to form the zygomatico-temporal and zygomatico-facial nerves. The posterior superior alveolar nerves also branch from the maxillary nerve, exit the fossa via the pterygomaxillary fissure, and enter the maxillary tuberosity to serve the maxillary sinus, molars, and adjacent gingiva and cheek. The maxillary nerve then enters the orbit by way of the inferior orbital fissure and is referred to as the infraorbital nerve. While in the Pterygopalatin fossa, the maxillary nerve communicates with the Pterygopalatin ganglion via two small trunks, the Pterygopalatin nerves. However, these nerves do not bear a functional relationship with the ganglion. Postganglionic parasympathetic fibers derived from the ganglion ride along and distribute with branches of the maxillary division of the trigeminal nerve. These branches, which appear to arise from the ganglion, are described here and, in more detail. Orbital branches are slender nerves that supply the periosteum of the orbit and the mucoperiosteum of the ethmoidal and sphenoidal sinuses. The greater palatine nerve and its branches, the lesser palatine and posterior inferior nasal branches, descend through the Pterygopalatin canal to supply regions of the palate, gingiva, tonsil, and lateral wall of the nasal fossa. Posterior superior nasal branches leave the Pterygopalatin fossa via the sphenopalatine foramen to serve the posterior aspect of the nasal fossa and part of the ethmoidal sinus. Its nasopalatine branch grooves the vomer bone in its path to the incisive foramen of the anterior hard palate, which it supplies. The pharyngeal nerve traverses the pharyngeal canal to innervate part of the nasopharynx. Pterygopalatin ganglion. The Pterygopalatin ganglion is a parasympathetic ganglion of the facial nerve, cranial nerve 7. Preganglionic parasympathetic fibers enter the ganglion where they synapse on postganglionic cell bodies. Postganglionic parasympathetic fibers are communicated to the maxillary nerve for distribution to the lacrimal gland, mucosal glands of the nasal fossa, palate, and pharynx. The Pterygopalatin ganglion seems to be functionally associated with the maxillary division of the trigeminal nerve because it is suspended by the Pterygopalatin nerves within the fossa. It is, however, a parasympathetic ganglion of the facial nerve, cranial nerve 7. This ganglion receives its parasympathetic preganglionic route by way of the pterygoid canal, which opens onto the posterior wall of the fossa. The preganglionic parasympathetic fibers synapse with postganglionic parasympathetic cell bodies within the ganglion. Postsynaptic parasympathetic fibers leave the ganglia and distribute with branches of the maxillary division of cranial nerve V. These fibers are secretomotor in function. They provide parasympathetic flow to the lacrimal gland and mucosal glands of the nasal fossa, palate, and pharynx. General morphology. The base of the nose, located between the two orbits and projecting forward from there to overhang the upper lip, is composed of a bony skeleton that is continuous with a cartilaginous skeleton anteriorly. The entire nose is covered by skin. The external nose is triangular. The base of the nose is located between the two orbits, and its distal portion overhangs the upper lip. Its skeleton is both bony and cartilaginous and is covered by integument. The skin is movable over the bony and superior part of the cartilaginous support but is intimately attached to the cartilage composing the bulb of the nose. The region of the nose between the two orbits is known as the root, from which the bony bridge extends along the dorsum, inferiorly, to terminate in the movable bulbous apex. The inferior surface of the apex contains the two oval openings, the nares, leading into the internal nose. The two nares are separated by a midline columna, columella, the inferior part of the cartilaginous nasal septum. The lateral aspect of the nares is formed by the AIA, or WLNG, of the nose. The skin of the nose follows the contours of the nares and enters the internal nose for a short distance to form a junction with the mucous membrane lining the cavity. Short, thick, bristle-like hairs, boabrissae, protrude from skin rich in sebaceous glands to strain particulate matter from the inhaled air. Nasal skeleton. Nasal bones, located at the root of the nose, articulate with bones of the face. The remainder of the nose is composed of a framework of several cartilages, the principal one being the median nasal septum. The skeleton of the nose is both bony and cartilaginous. The bony root is composed of the nasal bones, which articulate with each other, the maxillae, frontal, and ethmoid bones. The cartilaginous framework of the external nose is composed of 5 large, principal cartilages and a variable number of smaller cartilages. The principal cartilages are the median nasal septal and the paired lateral nasal and greater alar cartilages. The smaller ones are the vomeronasal, lesser alar, and accessory cartilages. The median nasal septal cartilage is a quadrangular plate of hyaline cartilage that articunates with the nasal bone, and the lateral and greater alar cartilages supero-anteriorly, the perpendicular plate of the ethmoid bone posteriorly, and the vomer, anterior nasal spine, and vomeronasal cartilage inferiorly. It separates the nasal cavity into right and left halves. The lateral nasal cartilage forms the part of the dorsum of the nose. It is a triangular plate of hyaline cartilage whose base articulates with the nasal and maxillary bones superolaterally, the median septal cartilage medially, and the lesser and greater alar cartilages inferiorly. The greater alar cartilage is a C-shaped hyaline cartilage forming the lateral and medial walls of the nostril of the same side so that the nares present a constant opening. It is connected to the lesser alar and lateral nasal cartilages superiorly and the median nasal septal cartilage medially and inferiorly. The nasal cavity is divided into right and left nasal fossae by the median nasal septum. The anterior aperture of each fossa is the nares, whereas the posterior aperture is the choana. Each nasal fossa possesses 4 outpocketings called paranasal sinuses. The median nasal septum, consisting of bony and cartilaginous components, subdivides the nasal cavity into a right and a left nasal fossa. Each nasal fossa has anterior and posterior apertures, the nares and choana, respectively. In addition, each possesses 4 outpocketings termed the paranasal or accessory sinuses, a medial and a lateral wall, a floor and a roof. The entrance into the nasal fossa immediately superior to the nares is a bilateral area of that cavity ringed by the greater alar cartilage termed the vestibule. The vestibule is lined by skin possessing vibrissae and sebaceous glands. The superiormost portion of the nasal fossa, specialized for olfaction, is the olfactory region, whereas the larger, inferior portion is the respiratory region. Medial wall. The medial wall of the nasal fossa, the median nasal septum, is composed of the vomer, the perpendicular plate of the ethmoid, and the median nasal septal cartilage. The entire median nasal septum is covered by mucoperiosteum. Frequently, this septum deviates to one side, infringing on the nasal fossa of that side. Associated with the anteroinferior aspect of the septum is the vestigial vomeronasal organ, the Jacobson organ, lying on the vomeronasal cartilage. This structure, olfactory in nature, is well developed in some lower animals. Lateral wall. The lateral wall of the nasal fossa differs from the medial wall. Instead of being relatively smooth, it presents three scrolled laminae of bone that jut medially. Epistaxis, nosebleed, bleeding from the nose subsequent to injury of the nose is a common occurrence and is usually relatively easy to control. Normally, the source of blood flow is the Kieselbach area, the anteroinferior region of the nasal septum where the septal branch of the supralabial, anterior ethmoidal, nasopalatine, and greater palatine arteries anastomose. The bleeding is controlled by pressure or by packing the nose with cotton. Occasionally, bleeding is from higher up in the nose where control may require more heroic action. When the injury is from a direct blow, the cribriform plate of the ethmoid bone may fractured. Deviated nasal septum. The nasal septum can be deviated from birth, but, more often, it is from an injury in childhood or during adulthood, especially those associated with contact sports. A slight deviation may be unnoticeable or it may be observed as a lateral bend in the nose when observed from a frontal view. When severe, the nasal septum may be displaced to one side so that it is in contact with the lateral nasal wall, thus reducing respiratory capability, causing infection, inflammation, and sinusitis, indicating the necessity for surgical treatment. Into the nasal fossa. These turbinate bones, covered by mucoperiosteum, are referred to as the superior, middle, and inferior nasal conchae. Inferior and lateral, under the cover of the projecting concha, is the correspondingly named meatus. Superior to the superior meatus, just anterior to the body of the sphenoid bone, is the sphenoethmoidal recess containing the ostium, opening, of the sphenoidal sinus. A region of another sinus, the posterior ethmoidal air cells, opens below the superior concha into the anterior region of the superior meatus. The middle nasal concha overlays and covers the lateral wall of the middle meatus. A marked, rounded projection is formed on this wall by the middle ethmoidal air cells of the ethmoidal air sinus. This rounded projection is known as the ethmoidal bulletin IA, richly vascularized respiratory mucosa lining most of the nasal fossa and moistening the inhaled air, and a yellowish-brown olfactory mucosa, responsible for olfaction, located superiorly. Paranasal sinuses are hollow cavities lined with respiratory mucosa within the maxillae, frontal, ethmoid, and sphenoid bones. These sinuses are in communication with the nasal fossa via small ostia. The maxillae, frontal, ethmoid, and sphenoid bones contain hollow cavities, the paranasal sinuses, lined by respiratory mucosa. These cavities, as described earlier, communicate with the nasal fossae via small. The function of these sinuses is not known, although it has been suggested that they act as resonators during speech and decrease the weight of the head. The latter explanation is not reasonable because the weight of bone marrow and cancellous bone that would occupy this space is negligible. The capacity of these sinuses as resonators during speech is also questionable because they are present in animals that seldom vocalize. Furthermore, in humans, blocked or fluid-filled sinuses do not impair speech production to any great extent. The sinuses develop postnatally, although the unlogen of the sphenoidal, maxillary, and ethmoidal sinuses are present at birth. The mucous membrane lining the sinuses is continuous with that of the nasal fossae via the various ostia of the sinuses into the fossa. The ostia, although already small on the dry skull, are reduced even further in size in the living individual, so much so that they are minute. Hence, communication between the sinuses and the nasal fossa is readily impeded during respiratory congestion. 3 of the 4 sinuses are bilateral. Although the sphenoidal sinus, located in the midline, is not bilateral, it is divided into two halves by an interposed plate of bone. Maxillary sinus. The maxillary sinus, the largest of the paranasal sinuses, is positioned lateral to the nasal cavity, inferior to the orbit, and often extends into the zygomatic process of the maxilla. The floor of the sinus is intimately related to the maxillary first and second molars, whose roots not only form considerable bulges but also may perforate the osseous floor of the sinus. Moreover, if the sinus is large, the third molar and second premolar may also be involved with its floor. The supromedial wall of the sinus consistently communicates with the ethmoidal infundibulum by way of the maxillary ostium, and inconsistently communicates with the middle meatus via the accessory maxillary ostium. Frontal sinus. The frontal sinus pneumatizes the forehead and is incompletely subdivided into two or more compartments: maxillary molars and the maxillary sinus. The roots of the maxillary molars bulge into the floor of the maxillary sinus but normally do not perforate the mucous membrane of the sinus. Extreme care must be given when extracting the maxillary molars because a fractured root may be driven into the maxillary sinus, forming a communication between the oral cavity and the maxillary sinus and thus increasing the chance of sinus infection. Maxillary sinus inflammation can be confused with toothache in the molar region because the posterior superior alveolar nerve of the maxillary division of the trigeminal nerve serves both the maxillary sinus and the molar teeth with sensory innervation. Cerebrospinal rhinorrhea. During fracture of the ethmoid bone, cerebrospinal fluid may leak into the nasal fossa and out through the external nares. This condition, cerebrospinal rhinorrhea, may lead to meningitis, with possibly fatal consequences. Posterior air cells drain into the superior meatus, the middle cells into the middle meatus just above the bulla ethmoidalis, and the anterior air cells into the ethmoidal infundibulum and thence into the middle meatus via the semilunar hiatus. Sphenoidal sinus. The sphenoidal sinus hollows out the body of the sphenoid bone and is separated into two asymmetrical halves by a plate of bone, the sphenoidal septum, which usually deviates to one side. The sphenoidal sinus drains into the sphenoethmoidal recess of the nasal fossa through the sphenoidal ostium. Vascular supply. Branches of the facial, ophthalmic, and maxillary arteries vascularize the nasal cavity and paranasal sinuses. The vascular supply of the nasal fossa is derived from several sources: branches of the facial, ophthalmic, and maxillary arteries. The vestibule receives septal branches from the facial artery. The ophthalmic artery supplies anterior and posterior ethmoidal branches to regions of the superior and middle conchae and meatus, to the middle nasal septum, and to the frontal and ethmoidal sinuses. The maxillary artery provides several branches to the nasal fossa. The greater palatine branches serve the anterior floor and posterior aspect of the nasal fossa. The sphenopalatine branch, entering via the sphenopalatine foramen, vascularizes portions of nasal conchae and meatus via its posterior lateral nasal branches as well as the posterior segment of the median nasal septum by its posterior septal branches. Terminal branches of these vessels form a rich anastomotic vascular plexus in the mucoperiosteum. The maxillary artery provides vascularization of the four paranasal sinuses via the posterior lateral nasal branch of the sphenopalatine artery. In addition, the anterior and posterior superior alveolar arteries serve the maxillary sinus, whereas the pharyngeal artery and the artery of the pterygoid canal supply the sphenoidal sinus. The ophthalmic artery, via its anterior and posterior ethmoidal branches, assists in vascularizing the frontal, ethmoidal, and sphenoidal sinuses. Venous drainage of the nose and paranasal sinuses is by way of the anterior and posterior ethmoidal veins into the ophthalmic vein, the sphenopalatine vein into the pterygoid plexus of veins, and the vein of the foramen cecum into the superior sagittal sinus. Because these venous elements usually do not possess valves, infection may be propagated throughout the entire system, affecting the dural venous sinuses, especially the cavernous sinus, and resulting in serious and, perhaps, life-threatening complications. Nerve supply. Ophthalmic, V, and maxillary, VOL divisions of the trigeminal nerve provide general sensation to the respiratory mucosa. Olfaction, smell, is provided by cranial nerve I. Secretomotor fibers from the facial nerve, cranial nerve 7, are communicated from the pterygopalatine ganglion to the maxillary division, V2T4 delivery to the mucoperiosteum. General sensory innervation to the respiratory mucosa is derived from the trigeminal nerve, in particular from its ophthalmic and maxillary divisions. The olfactory epithelium receives its special visceral afferent fibers for smell from the olfactory nerves. Cranial sinusitis, or inflammation of the mucosa of the paranasal sinuses, results in swelling of the mucoperiosteum, which blocks the ostia of the sinuses. This irritation causes accumulation of mucus in the sinuses, resulting in increased pressure and displacement of the air normally located therein. This pressure causes sinus headaches of varied intensity, and, if untreated, the infection may spread to the inner ear and the middle ear as well as to other areas. Infection of the frontal sinus, if left untreated, may result in frontal bone osteomyelitis because venous drainage of the sinus is intimately related to diploic veins and indirectly related with those of the dura and scalp. The ethmoidal air cells are in close relationship with the orbit, with only a paper-thin lamina of bone separating these structures. Hence, in cases of severe infection, this bony separation may be perforated and the infection may involve the orbit, resulting in orbital cellulitis. The maxillary sinus is prone to infection because it is intimately associated with the first and second maxillary molars. Dental involvement may result from abscess, from carious lesions, or from tooth extractions with part of the floor of the maxillary sinus being removed in the process. Knowledge of the anatomy of the sinuses and röntgenographic analysis of the involved area should be a prerequisite to maxillary tooth extraction. Nervi, axons of which pass via perforations in the overlying cribriform plate of the ethmoid bone to the olfactory bulb. Secretomotor fibers derived from the facial nerve, cranial nerve 7, reach the mucoperiosteum via communications carried by branches of the maxillary division of the trigeminal nerve. The paranasal sinuses also receive sensory innervation via the ophthalmic and maxillary divisions of the trigeminal nerve. The frontal sinus receives its sensory innervation via branches of the frontal and nasociliary nerves of the ophthalmic division of the trigeminal nerve. The ethmoidal sinuses are served by ethmoidal branches of the nasociliary nerve and by orbital and nasal branches of the maxillary division of the trigeminal nerve. The sphenoidal sinus is served by ethmoidal branches of the nasociliary nerve and orbital branches of the maxillary division. The maxillary sinus receives its innervation solely from the maxillary division, specifically from the superior alveolar nerves.